Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. Sometimes referred to as an STD, a sexually transmitted disease, many people wonder if viral hepatitis can be spread through oral sex. The truth is, the answer to that question varies with each of the three most common kinds of viral hepatitis. Oral sex refers to sexual activities that involve the stimulation of the genitals with the mouth, tongue, teeth, or throat. The three main types of oral sex are cunnilingus. This refers to oral stimulation of a female's outer genitalia. Fellatio. This refers to oral stimulation of a male's outer genitalia. And analingus. This refers to oral stimulation of the anus. Those in long-term monogamous relationships who do not have any contagious illnesses have virtually no risk of getting a sexually transmitted disease through oral sex. For everyone else, the risks of sexually transmitted diseases are a major concern and can only be avoided through education, protection, and/or abstinence. The three most common kinds of viral hepatitis, known by the alphabetical letters A, B, and C, are each transmitted by slightly different routes. Hepatitis A is transmitted when infected feces enters another person's digestive system. Hepatitis B is transmitted through contaminated blood, sweat, tears, saliva, semen, vaginal secretions, menstrual blood, and breast milk. And hepatitis C is transmitted through the blood, when infected blood of one person enters another person's bloodstream. Thus, the risk of contracting viral hepatitis through oral sex is different for each strain. Hepatitis A. The hepatitis A virus is highly concentrated in the feces. For someone who has hepatitis A, even clean-looking anal skin is likely to contain the virus. Therefore, there is a substantial risk in acquiring hepatitis A from analingus. Several epidemic outbreaks have been reported among gay men, but heterosexuals practicing analingus are just as likely to be at risk for contracting hepatitis A. There is, however, a vaccine available to prevent hepatitis A infection. Hepatitis B. The hepatitis B virus can cause chronic liver disease, which can potentially be fatal. Considered to be 100 times more infectious than HIV, hepatitis B viral particles are in semen, vaginal secretions, stool, tears, saliva, sweat, and blood, including menstrual blood. There is clear evidence that hepatitis B can be transmitted through vaginal and anal intercourse, but it is unproven whether it can be transmitted through oral sex. Since it is so contagious, there is a theoretical risk of transmitting hepatitis B through cunnilingus, fellatio, or analingus. Luckily, there is also a vaccine to prevent hepatitis B. Hepatitis C. The hepatitis C virus can also cause potentially fatal chronic liver disease. Transmitted from blood-to-blood contact, this illness is much harder to get from sexual contact. Even though there is little evidence proving you can get hepatitis C through oral sex, a theoretical risk exists if there is any blood present in the giver or the receiver. So, a risk of transmitting hepatitis C by cunnilingus, fellatio, or analingus exists if there is any menstrual blood, bleeding gums, throat infection, cold sores, canker sores, genital warts, hemorrhoids, or any other breaks in the skin in any involved body structure. That could be the vagina, the clitoris, the labia, the penis, testicles, anus, perineum, lips, tongue, or anywhere else on the genitalia or inside the mouth. Unfortunately, a vaccine does not yet exist for hepatitis C. According to experts, viral hepatitis is more likely to be transmitted if either the currently infected or non-infected partner has another STD, especially ones that cause sores or lesions. Because of this, suspicious-looking areas should always be checked by a doctor before engaging in oral sex. Besides being vaccinated against hepatitis A and B, safe sex practices can help prevent the spread of viral hepatitis. Using condoms can prevent disease transmission during fellatio. Latex or polyurethane condoms are best for disease prevention, since natural skin condoms have small pores that can let the viruses through. Latex dental dams, sheets of plastic wrap, and latex sheets sold specifically for oral sex can help prevent disease transmission during cunnilingus or analingus. The risk of transmitting viral hepatitis during oral sex is low. However, practitioners suggest abstaining if there are any cuts or sores on the mouth or genital areas. Additionally, some experts suggest avoiding brushing or flossing teeth right before or after oral sex, since these activities may create tiny abrasions or result in bleeding gums. Vaccinations against hepatitis A and B can protect you if you are exposed to one of these viral particles during oral sex. However, these vaccines do not protect against hepatitis C or any other STD. To sum up, knowing what situations are riskiest and being prepared to abstain or practice safe sex is your best bet for engaging in disease-free oral sex.